Can diverticulosis cause rectal bleeding? Have you ever wondered if diverticulosis can lead to rectal bleeding? This is a common concern for many, especially those dealing with digestive issues. Let's break it down in simple terms. Diverticulosis is a condition where small pouches, known as diverticula, form in the wall of the large intestine or colon. These pouches develop at weak spots in the colon wall, often where blood vessels pass through. The formation of diverticula is linked to increased pressure inside the colon, which can happen when stool is hard or difficult to pass. This is often due to a low-fiber diet. Most people with diverticulosis do not experience symptoms. However, complications can arise, and one of these is diverticular bleeding. This occurs when small blood vessels next to the diverticula rupture. The rupture is commonly caused by chronic injury or trauma to these vessels from pressure and stool passage. When a blood vessel breaks, it can lead to sudden and sometimes severe bleeding from the rectum. The blood may appear as bright red or dark red clots in the stool, and this bleeding typically happens without any abdominal pain. Interestingly, about 10% of individuals with diverticulosis may experience this type of bleeding. It is usually painless and can be quite noticeable due to the amount of blood involved. The bleeding occurs because the blood vessels supplying the diverticula can undergo changes, such as thickening and scarring, making them more likely to rupture. Importantly, this bleeding is not usually connected to inflammation or infection of the diverticula, which is known as diverticulitis. For those with sensitive stomachs, such as individuals with irritable bowel syndrome or colitis, diverticular bleeding can be alarming. While irritable bowel syndrome is a functional disorder and colitis involves inflammation, diverticulosis represents a structural issue in the colon wall. The presence of diverticulosis and potential bleeding may complicate symptom management for sensitive individuals, especially if they experience changes in bowel habits or abdominal discomfort. To help manage these risks, it is important to maintain a diet high in fiber. This can reduce pressure in the colon and help prevent the formation or worsening of diverticula. Managing constipation and avoiding straining during bowel movements can also lower the risk of diverticular bleeding. If rectal bleeding does occur, seeking medical evaluation is essential to determine the cause and receive appropriate treatment. In summary, diverticulosis can indeed cause rectal bleeding due to the rupture of blood vessels near the diverticula. This bleeding is typically sudden, painless, and can be significant. For individuals with sensitive digestive conditions, awareness and careful management of diet and bowel habits are key to minimizing risks related to diverticulosis and its complications.